This morning, a CDC panel will decide whether to change vaccine guidelines that have long been recommended for children, including whether to continue administering hepatitis B vaccines for all newborns. ABC's Nicole D'Antonio with details.
This morning, a critical vote is set to be taken on whether to keep recommending the hepatitis B vaccine for all newborns.
Let's just pause for a second. We have the ability to prevent children from getting cancer if we give every child a hepatitis B birth dose.
For decades, giving the shot at birth has been standard and is credited with virtually eliminating hepatitis B among babies in the U.S. But today, the Centers for Disease Control's Vaccine Advisory Committee will decide whether to end that universal birth dose, recommending it only for babies of mothers who test positive, letting other babies wait at least a month. Critics warn that could miss infants when testing isn't done or when results are wrong.
That's why the safety net of the birth dose is so important.
The committee also plans to vote on the COVID-19 vaccine recommendation today. It comes after the panel decided Thursday to limit the availability of the widely used combination vaccine that fights the measles, mumps, rubella, and the virus that causes chickenpox, meaning children could need to get those shots separately during multiple doctor's visits. The American Academy of Pediatrics blasting the recommendations from the new CDC advisory panel.
I say you should disregard anything that comes from this committee. They don't seem to care about the actual science. They seem to care about promoting false claims and myths and rumors and junk science.
The changes come from the new advisors picked by Health Secretary Robert F. Kennedy, a longtime anti-vaccine activist who fired all the members of the previous committee and filled the panel with several members who share his own views on vaccinations. Now 7 northeastern U.S. states, including New York, Pennsylvania, and New Jersey, have banded together to form a new public health coalition that will make its own vaccine recommendations. There's a similar effort happening on the West Coast. California, Oregon, Washington, and Hawaii creating the West Coast Health Alliance, and this week rolled out their own vaccine recommendations for families. Nicole D'Antonio, ABC News, Washington.